A warm and present greetings to all. I'm here to present my paper under the topic Smiling Seniors, addressing the barriers in geriatric dental care. Aging is a natural process. Old age should be regarded as a normal and inevitable biological phenomenon. This aging should be healthy and we should accept it as a milestone. So, what is healthy aging? Healthy aging is not only being disease free but the maintenance of functional ability in elderly patients. Why are we speaking about healthy aging here? It's because oral health and systemic health are interlinked and it is important for healthy aging. How can this healthy aging be achieved effectively? First, there are policies to improve oral health systems. National Dental Association supports policy makers to implement oral health policies. They formulate guidelines, organize community oral health promotions, and interprofessional trainings. In undergraduate curricula, we may include some basics on managing elderly patients. Individual healthcare professionals, along with medical colleagues, can provide multidisciplinary care. So, why should we be concerned about healthy aging? Because, as an individual, elderly people should enjoy their life activities, their quality of life should be enhanced, and they should lead a healthy life. They should be independent of their families. They should spend longer time with their family members, and this has a positive influence on grandchildren. They should participate in social activities. For this, oral health is important because oral health influence on other systemic conditions also. Oral inflammatory reactions can contribute to systemic inflammatory conditions. For example, as we all know, periodontal disease is the sixth complication of diabetes. It also has effect on cardiovascular system. Thus, oral health has an influence on systemic health. When we speak about cognitive health, increase in systemic inflammation increases dementia. Weight loss causes decrease in nutritional intake, which results in impairment of central nervous system. As for nutritional health, hyposalivation causes chewing and swallowing function decrease. Oral disease has negative effect on appearance and social activities and hence reduce the quality of life for elderly patients. Now, coming to barriers that may cause lack of dental care to geriatric patients may include physically compromising conditions like limited mobility and transportation issues which make them difficult to access the dental clinics. Dental anxiety is a primary obstacle hindering patients of all age groups from accessing the necessary treatment. Visual and hearing impairment make it challenging for communication with elderly people. Financially, elderly people are dependent on their pension or on their children, thus making them to have a limited income, which may have an impact on their dental expenses. Commonly, elderly people are medically compromised and they are under multiple medication. As for dentists, fear of treating elderly patients and lack of experience and confidence are barriers from our sides. So, with these barriers, managing elderly patients should mainly include preventive management like regular dental checkups, and maintaining proper oral hygiene. Restorative management includes alteration in restorative materials and techniques. Periodontal problems are most commonly seen in geriatric patients, which should be managed conservatively and non-surgically. Surgical procedures can also be done in inevitable situations. Edentialism, edentialism is another common condition seen in elderly people, which can be treated by providing dentures. Solution for these difficulties can be given for both patient-related and dentist-related barriers, in which patient-related barriers can be solved by domiciliary dental care, mobile dental vans, arranging transportation facilities for elderly people. For dentists, more knowledge about geriatric conditions and improving skills on ability to approach geriatric patients can help them treat these patients effectively. To end my presentation, barriers and challenges are part of our dental practice. Hence, we should improve our skills to handle such kind of situations and find solutions to tackle them to provide an ethical and patient related treatment towards creating smiles. These are my references. Thank you for giving me this opportunity.